Well, we'll preface this discussion of this organism with this case. Okay, a 50-cent-old farmer. Those are capitalized, so those are important historical the history components. Is brought to ER with chills, fever, and slightly stiff neck. Just initial stages of perhaps meningitis. Okay, he had been to the hospital 5 days earlier for his cancer chemotherapy. That's a very, very important clue. Cancer chemotherapy translates into immunosuppression. So it is not commonly the organism that means that commonly it will not infect normal individuals unless they are somewhat immunosuppressed. The day after his chemotherapy, he had diarrhea and vomiting, which he attributed to having consumed cheese that might have been in the refrigerator too long. Dairy product, refrigeration still, because the organism, as I will tell you later, grows readily at 4 degrees, 10 degrees. It will still grow at 10 degrees, which is the normal refrigeration temperature. Okay, diarrhea and vomiting. Too long. CBC revealed heightened number of monocytes. White blood cell leukocytosis, but in this case, it's monocytes. Normally, it is what? Neutrophils, right? Except in one case, I told you it was lymphocytes, T cells. That was Bordetella, pertussis. This is another exception of bacterial infection which causes non-neutrophil leukocytosis, and that is monocytes. And blood culture yielded beta hemolytic colonies. Beta hemolytic gram-positive bacilli. Cocobacilli. Okay, the choices are Vibrio cholerae. Could it be? No. Vibrio, as soon as you say Vibrio, comma shape, right? Dr. Fox told you about that. Brucella abortus, that is not gram-positive. Okay? So you can exclude that one right away. Listeria monocytogenes, that the word gives, monocytogenes, gives it away. Monocytosis, monocytogenes. Okay? Bacillus anthracis? No, it is not Bacillus anthracis. You'll see why not later on. Francisella tularensis? Not either. That's also gram-negative. And also, he does not have a lesion externally, a skin lesion or anything like that. So we can narrow this down to more near Listeria monocytogenes. It was discovered by from a rabbit, isolated from a rabbit with monocytosis, mononucleosis. Okay, in 1927 it was given its name to honor Lord Lister. Listerine, Lister, Listeria, same root. Lord Lister was a surgeon, obviously. Very interested in sterile conditions, interested in organisms. He was a well-accomplished surgeon, and he was honored by giving Listeria monocytogenes a name. Okay, in 1929, it was isolated from humans with mononucleosis-like disease. Mononucleosis-like disease. Okay, if you have learned about infectious mononucleosis, okay, you will know the symptoms, and we'll talk about the symptoms in a minute. Susceptible individual, healthy children and adults remain asymptomatic, and may be carriers. It is carried in birds, mammals, fish, insects, even in soil sometimes. It can be found. Humans get infected, food products, direct contact, environment, and If it, is normal, healthy adults or even children, they will remain asymptomatic carrier for a while and then, get rid of it. Pregnant women, it is asymptomatic in themselves, but it can cause miscarriage and septicemia as a neonatal disease. Okay, immunocompromised individuals, it is depending on how immunocompromised they are, it may remain asymptomatic. They can be carriers for a while until they recover from their immunocompromised condition. But occasionally it will cause meningitis, it will cause septicemia and superinfections. So infection of the spread in different organs. It is claimed to be one of the leading causes of meningitis among immunosuppressed individuals, among cancer patients or transplant patients. Epidemiology-wise, there are around 500, 600 cases every year. Last year, I think there was an epidemic of listeriosis, and it was traced to some milk products, and they had to be recalled. That's why you can see a little bit higher number. Okay, if you're lucky, you will see listeriosis in South Carolina. And distribution has it does not have a geographic distribution, particular geographic distribution. If one looks at the cases, here's South Carolina. This year, I could not find the data for this year, but last year there were 5 cases in South Carolina. Nationwide, about close to 900 cases, and neighboring states, North Carolina, Georgia, Florida, quite close. They were about 100 cases last year. So it's not as rare as Yersinia pestis. Morphology is a gram-positive Bacillus. It grows in short chains. Okay. Just like any other gram-positive. It's beta-hemolytic, like strep pyogenes. Okay, if you remember that, strep pyogenes. As a matter of fact, it has a virulence factor that is very, very, very similar to strep pyogenes hemolytic streptolysin. Okay, you can see streak marks, and where the bacteria are growing, the blood agar is lysed. Okay, blue-green translucent colonies on colorless media, and of course you saw the hemolytic colonies on blood agar. Can grow and replicate at 4 degrees, as low as 4 degrees. So that's why refrigerated milk products, they're particularly dangerous for immunosuppressed individuals, or can cause some problems in pregnant women. Normal adults are resistant, common organism, very common, infection among HIV-infected and other immunosuppressed patients. And that's probably where those 4 or 5 cases last year came from. Causes gastroenteritis among these people. It will cause septicemia, of course, as they can't get rid of the organism. It is going to cause meningitis. And as I mentioned, major cause of meningitis among cancer chemotherapy and transplant patients. There is a specific neonatal disease that mothers have, if they get infected, pregnant women, expecting women, if they get infected, they are going to be symptomless, but it can migrate into the fetus, and it can cause a condition called granulomatosis infantiseptica. It has been covered in pathology? Not? Well, don't recall, okay? Never mind. Wasn't on the exam? No, okay. Okay, the infection of the fetus in utero, okay, which will lead to abortion or disease at birth through the birth canal, sepsis, will cause sepsis, pneumonia, fetal distress, seizure, and rash, abscesses and granulomas in the newborn. High mortality rate in the newborn if they are infected in utero. Remember that their immune system is not fully developed, particularly cell-mediated immunity, and the organism, as you will see later on, is an intercellular parasite. It can grow, survive, and intracellularly, and therefore it will not be eliminated by antibodies that the mother will transfer to the baby. So the babies may have antibodies, but they will not resist the infection. It can be acquired exposure on vaginal delivery, as I said earlier, and that would lead to meningitis or meningoencephalitis with sepsis within 2 to 3 weeks. Okay, the incidence and mortality, meningitis, okay. If there is meningitis, there's a higher rate of, there's a much higher rate of mortality. Other CNS infections, if it invades CNS, very high mortality. Primary bacteremia, some mortality. If it causes endocarditis, there will still be, so it can cause mortality in these individuals who are immunosuppressed. Virulence properties, beta-hemolysin. That lysis, causes lysis of the cells, and I'll tell you a little bit later when we talk about the organism, another characteristic of the organism where beta-hemolysin would contribute to spreading of the organism. Okay, produced by virulent strains only. Okay, so it is probably, or it is plasmid coated. Is oxygen labile. In other words, if it is exposed to oxygen, the beta-hemolysin, it will destroy cytolytic properties. It is antigenic, immunogenic, so people who are infected will produce antibodies against it. It disrupts phagolysosome. So, if the organism is internalized, it produces beta-hemolysin, it will disrupt the phagosome before it fuses with the lysosome, and therefore it will become cytoplasmic. And now the organism cannot be killed. Okay? Intracellular growth, and it will grow intracellularly in cytoplasm. Okay, and here is a laboratory photograph of macrophages, macrophages where the organism is growing. As a matter of fact, the organism has been extensively used in the study of immunology of intracellular parasite, cell-mediated immunity, macrophage activation, and so forth. If these macrophages were activated, which they will be, because we as healthy individuals, as we get infected, we are going to produce cell-mediated immunity, cytokines related to the cell-mediated immunity. There will be interferon gamma produced, there will be TNF produced, okay, and that will in turn activate macrophages, and those activated macrophages are going to kill the organism before it escapes from the phagosome and divide there. Okay, bacterium escapes from the host vacuole That's what I just said, phagosome, escape from the phagosome, undergoes rapid division. It becomes encapsulated in short actin filaments. So it binds actin filaments, and once it binds them, it sort of forms a channel and moves towards the periphery, protrudes from there, and those protrusions will penetrate another uninfected cell, another uninfected monocyte, and they will get infected directly. So it does not have to come from one phagocytic cell where it is growing, come out, be internalized by another phagocyte, and to infect them. It can directly transmit it. You can almost form a channel, a tunnel from one cell to another one, and it does not have to come out into the circulation to be exposed to antibodies that are produced against it. Okay, and here's a picture of what happens. Here the organism is entering, lyses the phagosomal vacuole because of having a streptolysin. It is released, it gets covered or with actin, and then actin forms a sort of like comet tail that pushes it out towards the periphery, and it will form these protrusions, and those protrusions, when they are together with another cell, again the streptolysin is going to dissolve these membranes, and then the organism will be internalized there, or just the fact that these membranes fusing, it will enter the other organism, and there it will lyse these vacuoles that have been formed and become cytoplasmic again and grow there, and the cycle can continue. So from one cell to another. Characteristic feature of, does it remind you of another organism that Dr. Mayer talked about? No? Well, you'll remember by tomorrow, right? I can appreciate that. Okay, I know. Okay, so entry, escape, replication. Yes. One of the rickettsia. Rickettsia. Huh? It's not on this quiz, but it will be on the exam. You don't have to worry about tomorrow. No. No, it won't be on the quiz. His questions are not on the quiz. It's only Dr. Fox and I. Okay. No. I'm going to address that. I know the book you are looking into, and you can come and tell me that it is, but when it comes to, say, somebody says LPS, think of gram-negative. Okay? What I will tell you, and now he has already brought up the topic, doesn't it have LPS as well? It has an LPS-like molecule. That's how it is referred to by bacteriologists, because they like to keep gram-negative and LPS associated together. Okay? Yeah, I know. No, but in my note, I particularly make sure that it is called LPS-like. So if you say that, if you somewhere find LPS, with an organism, organism with gram-negative, think of gram-negative, it's with LPS association, okay? And that's why most books and everywhere you'll find that they call it LPS-like molecule. Yeah. Okay. Penicillin or ampicillin are the antibiotics for treatment. They can be combined with gentamicin. Protection with the activation of macrophages. I already told you that. Normal healthy individuals, it enters the body. If we were to take antibody titers of a population, a lot of us will have positive, some antibody to this organism because it's not rare, okay, in dairy products and meat products. Okay, now we know it poses the same question just to remind you, and it is monocytosis, Listeria monocytogenes. As soon as you see monocytosis mentioned, and other conditions, you think of Listeria monocytogenes. Yes?
What's the mechanism for the monocytosis? Why do you have that?
Okay, whenever there's an infection, okay, that's a very good question. No, I cannot give you pathogenic mechanism. I can give you the general explanation for leukocytosis. Whenever there's an infection, okay, there is an SOS signal to produce more, bring out more neutrophils from the white cells from the bone marrow. And most of the time, bacteria attract neutrophils. But in this case, for some reason that I do not know, I have not seen in anywhere textbooks that what is the component of the organism that causes influx of monocytes. Okay? It's likely that it induces, since it's intracellular, it induces one of those cytokines and chemokines that attracts more monocytes, or differentiation of monocytes. Monocyte differentiation factor. That's a good question, and it would be interesting for me to find out. Okay, so that is the case. Now we will move on to next organism, anthrax. And I guess, what stage were you when they were 2000? I guess you were in undergraduate school, anthrax, or high school, late high school, or college. Okay, 2000 and I think it was in 2001, 5 years ago. Yeah, it's your second year, so it was a freshman in college or sophomore. Okay, it is a major disease of herbivores, cattle, sheep, horses, hogs, as well as hogs are herbivores as well as they are omnivores actually, and goats. So think of association should be anybody who is associated with handling cattle, sheep, horses, goats. Okay, humans are infected by direct contact with the diseased animals. Their hides, their wool, brushes that are used on animals, or bone meal that is prepared to feed the other animals, and they can be, if you're handling that and it is contaminated, it can cause human infection. Inhalation of infected dust. As a matter of fact, for that reason, it was very common by inhalation among those who were in ginning area, for especially the combing and handling wool. And for that reason, at one stage, it was also known as wool sorter's disease. So association here is definitely, that's the natural infection. Postal male is not the normal route of infection with anthrax. But it has been used, and it is ingestion of infected meat is basis for Koch's postulate. That is the organism that was initially used by Koch to have his postulate. An organism isolated from a human infection, grown in tissue culture, injected into another animal, because obviously there are all sorts of fur animals, and all sorts of animals can be infected with this organism, and then the same organism was isolated from those infected animals. Okay, historically, here is a quote. Anybody recognizes that quote? It will become find us over the whole land of Egypt, and festering boils will break out on men and animals throughout the land. exodus. Okay, so again, like tularemia, this is also a very old disease, and in the form of dust, it can infect animals and as well as humans. It was the organism that was used during the Second World War.
Attention! Out front!
That is just to wake you up. In case you were, huh? Okay. Germany sponsored covert use of Bacillus anthracis against allies. They were infecting bovine and herding them towards the enemy territories to be consumed and slaughtered there, and thereby spreading the infection. A little bit of history of epidemiology here. Until in the 50s, okay? In the 50s, it was quite common infection. People handling animals that were infected. There was a vaccine that was introduced, animal vaccine, and these animals, domestic animals and dairy animals, started being vaccinated. And then, as you can see, there's a drastic decrease in the incidence. Every year, 2, 3, 4, 5 cases until 2001. And of these, all these cases, only 18 of these were inhalation anthrax. So if you add that, it comes to less than 0.1%. Okay, inhalation. And then what happens is one cultured cutaneous vaccine reported in 2000, and the next following year, 2001, 2 postings of contaminated letters, and there were 4 found contaminated. 22 cases, plus 1 lab-acquired case, 11 of these inhalational. So the vast majority of these cases was inhalation. And that's why there were 5 deaths as well, because inhalation anthrax is most dangerous. Not only that, but this was such a rare disease that it was not recognized immediately. Otherwise, it's a very easily treatable disease, particularly cutaneous anthrax, extremely easy to treat. Even inhalation, if one suspects an exposure, can be easily treated. Consequence of that were 32,000 prophylactic cases of doses of antibiotics used. The cost, enormous. Everybody wanted Cipro that year. Extensive contamination, contamination of postal system, and then later on, of course, our Capitol Hill, that was contaminated, then cost fortune. Thousands of false alarms and hoaxes were noted. I mean, people were just, making use of it as a fun, although it's not fun, really. That is what I have emphasized, I will emphasize in bioterrorism, now that I've got the file here, emphasize when we talk about bioterrorism this afternoon. Okay? That it's not the disease that causes the problem, it's the scare and fright for getting that disease that causes the problem. Then people were using it as a hoax. And as bad as that one of the students in that year's class said, oh, he put a little bit of sugar in his roommate's desk in an envelope. And I said, that's not funny. Because it became actually federal offense to play that kind of a joke at that time. One should never really use those sort of things as a practical joke. Okay, so what is the incidence now? 2001, obviously you can see 22, 23 cases, and then since then, very little. 1 or 2. Morphology and physiology of the organism is a gram-positive aerobic spore-forming bacillus. Spore-forming. That's the only one organism that is spore-forming. Here it grows sort of like filamentous chains. It's a thin gram-positive organism. Encapsulates itself in 5% CO2 atmosphere. Forms a capsule. Okay, here is the organism. If you see carefully, you can see the red sort of capsules around it. Spore formed in culture, soil, and dead animal tissues, but not in live animals. So organism that you isolate from the humans, live individuals, is not going to be encapsulated. What it does actually when it sort of sees adverse conditions, that's when it encapsulates. Forms the spores, I mean, not capsule. Okay? Here are the spores generating. And Dr. Fox already told you all about spores. And spores remain viable in soil for decades. I'll make that point. I think when I talk about bioterrorism, that how long it can persist. Now, the virulence is by a plasmid base. So Bacillus anthracis that you find in normal soils everywhere may not be a virulent organism. And this organism has been used extensively. The non-virulent form has been used extensively in studying bacterial physiology. Okay, it invades the nervous system, and you can find it in the CSF. The disease, most common, is cutaneous. And usually in the individuals, it starts off as a cutaneous form. And then the other form is inhalation. Cutaneous form is acquired by handling infected material. That's why the handlers of leather goods, unprocessed leather goods, the skin, furriers are likely to, those who prepare the fur are at the risk of that. Cutaneous inhalation, of course, if they're handling wool and it is or cotton, it is aerosolized and it will be cause inhalation anthrax. And the other form is gastrointestinal anthrax by ingestion of infected material. Accounts for more than the cutaneous form accounts for more than 95. You saw that thousands of cases, and only a few of them were 18 or so, I think, or 22 or so were inhalation in all those years. So the cutaneous form. Okay, the spores enter the broken skin. They germinate rapidly and proliferate at the site of entry. If they are phagocytized, now they will get encapsulated, and when they are phagocytized, they are not going to be killed very easily. Cutaneous anthrax consists of a vascular papule at the site of infection, small papule. Okay? Papule, this is not as small, but if you can look at here, these are sort of malignant spreading of infection and into papules. Okay? Around the main lesion, you see these are all papules there. Okay? There will be a black edematous lesion. If you can see that here, blackening there, and that is called eschar. Here is the edema. There is a main infection and edematous swelling of the hand. Coming back to this, here is what is typically called eschar. Rupture of the papules will reveal a black eschar. Here were the papules. When they ruptured, it form the black eschar. Okay, and around that would be malignant or spreading papules, again, infected with organism. Here are a few more presentations of it on the face. Okay, inhalation anthrax, again, the spores are inhaled, or the organisms can be inhaled, and the organism was prepared in a particular way, grown and processed in a particular way by warfare, so that it spreads, hydrophobic and electrostatic charge was such that it will spread. They were encapsulated in special preparation, so that if it's dropped as a bomb, that will explode, and the aerosol will spread. It will not be clumped; it will be aerosolized, and particles will disperse. Okay, but and that can cause very, very serious infection, fatal infection. Germination replicates. They germinate, replicate, and an infection of hilar lymph nodes, the lymph nodes around the trachea. Hemorrhagic necrosis of those lymph nodes, hemoptysis will occur, of course, and it will cause the patient, the infected individual, will have fever, malaise, myalgia, and non-productive cough at first, and then, of course, there will be bloody sputum. X-ray would characteristically show lobulated mediastinal widening. Okay, and you will see it in the next slide here. That was published in JAMA. See the widening of around the trachea. Very characteristic description of pulmonary anthrax here again. See the widening. Okay, abrupt onset of respiratory failure will occur within 1 to 2 days. Okay, so that was the pulmonary anthrax. The gastrointestinal ingestion of infected meat can cause that. Proliferation within the gut, GI tract. It will be followed by fever, acute abdominal pain, but it should be acute abdominal pain, vomiting, and bloody diarrhea, because there is the necrosis of the tissue. Intestinal eschar, similar to cutaneous lesions. One postmortem specimen here. And it will then from there spread to the lymph nodes, lead to septicemia and shock and death. Okay? It can metastasize, migrate to the brain. Here is a darkened eschar-like lesion in the brain of an autopsy specimen. Okay, pathogenesis. Now, important part of it. Virulence factors are a capsule, of course. Okay? And in this case, capsule is again not polysaccharide. It's polyglutamic acid. Okay, exotoxins, it produces 3 of them. One is known as lethal factor, one known as edema factor, one known as protective antigen, and they are short formed, usually EF, LF, and PA, protective antigen. Why they call it protective antigen, it will be clear to you in a minute. Well, might as well mention now, because that's the protein that is being used for a vaccine, or is being tried as a vaccine. Okay, why that chain? I'll come to that in a minute. Okay, capsule is glutamic acid, polyglutamic acid. It is antiphagocytic, resists phagocytosis, is plasmid encoded, and therefore the normal forms of normal non-pathogenic Bacillus anthracis is not virulent. is not a good immunogen, although it is being tried by some people. Antibodies to capsule are not protective, even if they are produced. What antibiotics are protective, we'll come to that later in a minute. Pathogenesis edema factor. Edema factor is a protein that binds to the membrane. From there it will enter, let's go back to that. Binds to the membrane. When it binds to the membrane, it becomes susceptible to enzymes, and that will cleave it and form a place for edema factor to combine with that. It's AB toxin, okay? AB toxin. The anthrax toxins, both edema factor and lethal factor, are AB toxins. But they are not connected to each other. Protective antigen has got to bind to a cell, and then it will be modified to bind edema factor, and the edema factor enters the cell. So that's the A moiety, obviously. This is the B moiety of AB toxin. This is A moiety. It will go into the cell. It will bind calmodulin, and now it will act as an adenylate cyclase and increase the cyclic AMP. Cyclic AMP will be, accumulation of cyclic AMP will lead to fluid, water extrusion from the cell and lead to edema. So that's the mechanism for edema and how edema factor works. The lethal factor is the other toxin, and that lethal factor is again dependent on a protein protective antigen, the same protective antigen that was involved in edema factor mode of action. It binds, it creates a site, slightly different shaped, of course, or different in configuration, and this site will bind lethal factor. And once lethal factor has bound, it is going to be internalized into the cell, and there what it does is activates production of expression, transcription. It activates transcription and production of a variety of inflammatory cytokines. And that is the cause for the mechanism of death. That has been postulated as mechanism of death. So protective antigen is very, very important peptide or protein that is required for the mode of action of both edema factor and lethal factor, and that is the protein that is being tried as a vaccine.
Wouldn't these cytokines work against?
Yes, in small quantities, yes. Okay? But if there is an overproduction of cytokines, remember, toxic shock syndrome was another one. Okay? It does cause pathogenesis, disease, and death. Tumor necrosis factor has been implicated in death due to shock. Okay? In toxic shock or septic shock with gram-negative organisms. Okay, so yes, in the small quantities, that's why we have them, that they can protect us or have a normal physiological function. But if they are produced in massive quantities, then they are harmful and lethal. They can be. Okay, here's another rendition of, that was published in JEM, Journal of New England Journal of Medicine it was. Okay, so cutaneous form, intestinal form, or pulmonary form, they all involve macrophages. They can be internalized. Of course, they will vegetate there. They are not going to be killed. They survive in the macrophage because they produce the capsule afterwards, and that is protective. And they produce the virulence factor, capsule, exotoxin, and other factors, and they migrate to regional lymph nodes. They will infect other macrophages, other phagocytic cells, and they will produce different cytokines that will lead to shock and death, or they can migrate through lymphatics to the brain or to the lung and cause edema and damage to the lung, as you saw earlier. And here is sort of enlargement of this insect, edema factor, cyclic AMP, increased water exclusion and edema, or TNF-alpha, interleukin-1 beta, and other cytokine shock and death. So just remember that the two pathways, two mechanisms by which this causes disease. I'll just finish after treatment. Cipro. Everybody remembers that's, and it still remains the antibiotic of choice. Prevention, antibodies to toxin complex is neutralizing and protective, and that is being tried as an antibiotic. Dr. Fox has had research projects for a long time with vaccine development, as well as I had for a couple of years before I left, working on the protective antigen as a vaccine. And it does offer protection in animals. Immunization of cattle and herbivore is a preventive method that you saw how the incidence went down from the 50s onwards, late 50s onwards. Immunize humans at risk. That's one vaccine was controversial among the Army because the Army was requiring, or Department of Defense was requiring all military personnel, Air Force as well as their personnel to be immunized, and that vaccine was not the protective antigen at that time. It had not been tried out. I don't know what they're using now. Okay, so I'll leave that slide and we'll take a break. Now you know about anthrax, and that's another one of the organisms that is on the high up on the list of bioterrorism. And at first, actually, it was thought that postal workers thing, it was thought that it was bioterrorism. It was bioterrorism, but not mediated by somebody from outside the country. But it is suspected. They have still not caught the person who mailed those letters. Yes, I'm going to continue with the next organism when we come back. Very last organism, but when we come back, go and have a lunch. I have got to organize an exam for graduate students.